And if we want to be part of integrative medicine, where that means we're working collaboratively with a patient's medical doctor, I better have a pretty darn good reason why I made the decisions I made, because my treatment plan is landing in their specialist's office. But there's lots of areas of medicine where the research is poor or it's observational, and we'd love to try and look at it from an interventional perspective, right? We watch lots of people do great things with the med diet. We don't always have interventional data. We want to talk about that so that we can talk to our patients about it in a language that's clear and helps with informed consent.
Welcome to Personalized by Vitamin Lab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Deiser. Please remember that the following discussion is for educational purposes only, and it's not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to Personalized by Vitamin Lab. I'm your host, Dr. David Deiser. Today on the show, I spoke with Dr. Jordan Robertson, ND, CEO of the Confident Clinician, clinic director, educator, podcaster, and all-around inspiring naturopathic doctor. She's also a North American Menopause Society certified menopause practitioner. Dr. Jordan has experience working as the off-site ND for the endometriosis clinic at McMaster University. She's developed and facilitated courses at McMaster on integrative medicine and nutrition, and has worked as a clinician in her own clinic as a naturopathic physician for many, many years. Her educational platform, the Confident Clinician, has grown to over 700 naturopathic doctors across Canada and the USA. There, she and her team support clinicians with the best science-based practices for integrative medicine, and she teaches regularly on how to support patients with PMS, PCOS, perimenopause, endometriosis, and menopause, among other conditions. We had a great chat today. We covered topics from continuing education to teaching in healthcare to how her programs can support evidence-based approaches to well-being in naturopathic clinical practice. Please enjoy our show with Dr. Jordan Robertson. Hello and welcome to Personalized. I'm here with Dr. Jordan Robertson. Welcome, doctor.
Oh, thanks for having me.
Thanks so much for coming on the show. I was just saying to you offline, but I'll share with the listeners that we've been doing the show for about 6 months now, and we have two kind of pathways. We're talking about personalized care, and then we're also talking about personalized careers. And in thinking about those and speaking with my colleagues here in British Columbia, your name's come up twice already. So I thought, okay, I need to reach out. I reached out, and within 2 minutes, you had signed up, and you were on, and we had our date scheduled. So really, really cool intro to kind of meet you, and I'm so glad that you have decided to come on the show.
Yeah, I'm excited too. I'm so glad that it worked out. You caught me in a lull, but once we get talking, you'll realize that our lulls are not lulls in my world. But you caught me at a good time, so I'm so happy that it worked out. Cool.
Well, you have such a unique career. Like, your career's been super interesting. I'd love to hear a little bit about how your personal experiences, sort of in life or in your career in naturopathic medicine, have led to this organization called the Confident Clinician. Can you tell me what's actually led to this organization being developed?
Yeah, I was so lucky when I was an undergraduate student. I actually was accepted into a program that was just in its infancy. So it's the Bachelor of Health Sciences program at McMaster University, which at the time didn't exist when I applied for it. I was actually part of the first graduating class. And the program was about becoming a better human, not about learning microbiology or learning to memorize the amino acids. The topic was health science, but the purpose was to become a better learner, a more critical thinker, a better leader, a person who could actually, self-authorize, right? And create projects for yourself and become a better just person in general. And so I had this great fortune of being in a program where the literal goals were to become a leader, but also to be in that program in its infancy. And it meant that as a student, I had incredible pull, right? My opinion mattered. I was part of that beta, we'll call it, where I watched my professors turn to me and say, Jordan, did you get what you needed out of this? Or how can I evaluate you so that you can demonstrate what you've learned? And so I did that program, became a huge advocate for that program, and the dean at the time maybe has become my hero in my lifetime, and such a North Star. I just always wanted to be like him because he broke rules. He, right. Did things that were just right, even though if it wasn't convention. And that was really important as like modeling that I needed to then become what I became. Even when I applied to naturopathic college, I was missing 3 of the prerequisites to go. And he looked at me and he's like, well, don't you think that this course sounds an awful lot like an English course, Jordan? And I was like, well, I guess. And so we changed the course codes on my transcript so that I could get into naturopathic college. So like I've been breaking the rules since before I became a naturopathic doctor. And it really was modeled to me by, Del Harnish, who was the leader of this program, to say, like, why aren't we always just doing what's right? Like, we don't have to do the things the way we've always done them just because that's the way we've always done them. So I literally got into naturopathic college because of him and because we changed my transcript. Yes. It. And so, but that became, that program and that, focus on critical thinking and good question asking and research became the basis for what became the Confident Clinician, even though I went to naturopathic college and I think I wrote 1 million multiple choice tests like everybody else, memorized a whole lot of things I forgot the day I graduated, but I left with a skill set that no one else had, right? I left with a skill set on critical appraisal and research and innovation that no one else had. And it was only a couple of years later when I realized that when I was thriving in my clinical practice and some of my peers were not, that it was because I had those original skills, not skills I had picked up in naturopathic college. I had those original skills. And then that's what led to the Confident Clinician. I realized that as an industry, we had this massive problem where we were making it the clinician's problem that we didn't have standards of care. We were making it the clinician's responsibility to create treatment protocols when, their medical doctor peers next door were just using up to date. And that didn't feel fair. It felt like it was going to be something that always stifled our growth as an organization and as an entire industry, unless we handed each other our work, unless we offered each other the resources that our counterparts have had all along. And that's where we built the Confident Clinician from.
Okay, I love it. Wow. What a journey. My goodness. So coming from McMaster, first of all, your journey starts with similar things I've heard from the first class, because I'm close to the Boucher campus, right? So I've heard a lot of the same things from the Boucher class, the naturopathic college out here, which now we have amalgamated with CCNM. But they had a similar experience with the dean, who was Dave Scotton, and the one of the course creators, Rochelle Heisel. They had a similar experience. Like, they really looked up to these two, and they had some influence on how the course was developed. Now, of course, we're taking lessons from McMaster with group-based learning and case assessments. Every week is a different case in the enhanced curriculum. And so McMaster started with that. They've always been revolutionary in sort of medical education. And you had an opportunity to go there for undergraduate. That's really, really cool. And such an awesome kind of baselines of framework for your career as a naturopath.
Well, and a huge part of my career that I left out, because otherwise it becomes a very long and maybe boring story, is that when I graduated from naturopathic college, my intent was to stay there and help innovate the way they delivered education. And I was rejected. Well, I was rejected 7 times over 5 years for teaching positions. But when I left, I actually went back to McMaster. After that first rejection, I went back to McMaster and said, you guys don't have any courses on how to read research in integrative medicine. I'd love to develop one for you. And I've now been teaching in that program for 15 years and have taught, we actually call it facilitation. It's not really teaching, it's facilitation courses on research in integrative medicine. I now teach a course on research in clinical nutrition. I've co-taught a course on space medicine, which literally is the coolest thing on my resume, that I facilitated a course with NASA on how do we help students think more innovatively about medicine in the absence of gravity. And I also have taught that first year course that was so influential for me around just how to be a better person. I taught that course for 10 years at McMaster as well. So, my training as a naturopathic doctor is almost this like incidental finding. It's really my work on innovation and learning and critical appraisal that's really shaped what I can offer and what I'm trying to support practitioners with through the Confident Clinician.
Yeah, right. Wow, I love that. You've got such a cool career being back in academia for so long. That's excellent. And you're still teaching with McMaster. Congratulations.
I'm still there. Yep.
Wow, awesome. You probably get to meet a lot of cool students too, people interested in different things, not just integrative care, of course. You're probably interested in lots of different things.
Yeah, I'm always amazed. And when I see students, when I connect with them on LinkedIn a few years down the road and they're working for the WHO or they have these amazing positions, because the program literally is creating these leaders and people that we need to solve problems we didn't even know we had 5 years ago in medicine. It's really amazing to watch what those students are capable of.
Definitely. So can you tell us a little bit about the Confident Clinician? So how have you been able to translate these skills in both leadership and research evaluation into this product, into this thing that integrative physicians and naturopaths are able to use? What's it like?
Yeah, it has many layers to it, right? We recognize that there's lots of different problems that clinicians struggle with in their day-to-day work. The simplest of problems to solve is that staying up to date and having that standard of care that we, so desperately need in our profession, where, if we know without a shadow of a doubt that we're going to use, zinc for acne, shouldn't we just all be giving the same dose, right? And yet, again, this is one of those times where, because we don't have standards and there's no resource for clinicians to turn to, we've made it each doctor's responsibility to look that dose up. And our most basic way we support clinicians is by just giving them those answers. So when they log in, they type in acne, and we've given them the evidence for what really a prescription could look like if they were going to give something to their patient. But take it one step deeper, and we also want them to have the confidence in how they deliver that treatment plan. And why would they pick zinc over something else? Why would they pick zinc over Accutane? Why would they, or would they, right? And bringing in this deeper knowledge into how we make clinical decisions. So when would you choose, option A over option B? What population's not going to be best served by option A, actually, because they're not represented well in the literature, or they have a baseline characteristic that makes option A not the right pick for them. We want our clinicians to actually deeply understand that. So even though we give them the answer in the moment, because it's like, shoot, your patient's literally across the table from you, we'll just tell you what to do. What really we need is to develop that confidence as clinicians, pun intended there, so that you can say, no, I know why I'm picking this. Actually, the literature supports this decision. And so we offer live and recorded deeper dives into each topic so that the clinician can show up with that level of expertise so that they can be the best person on the patient's healthcare team, really. That's what we want for them. And then that third layer, which is even deeper, is our leadership program. So we do have about 50 clinicians at any given time working through more leadership-based content, deeper critical appraisal, and those clinicians actually become our contributors. And so how we've been able to grow so much in the last 3 years is that I have zero intention of doing this all on my own, and I wanted to grow an entire cohort of clinicians who are confident delivering this information, and they actually work with us to grow as leaders, but then they work for us as contributors so that the database can grow fast enough to meet the needs of all of our clinicians.
And then they do conferences, right? They do little sort of, I guess, is it just for subscribers, or is it separate from your subscribership, the conferences that you put on?
Yeah, we have both, right? So we recognize that, some clinicians are going to want to taste test what it looks like to work with us. And truthfully, I think we've all been a little scarred by continuing education, right? If I think about what my experience with CE had been before I just started from scratch and made something we all needed, was that you would go to a conference, they'd give you a PDF, they would spend 15 slides talking about the etiology of IBS, and on the last slide, they'd give you a protocol, and you'd be dying for something when it was over, whether it was a clinical pearl or a bit of wisdom or maybe a reference. And then you would put that PDF on your computer. You'd never open it again. You'd submit your CE credits and call it a day, right? That is CE, right? So we're scarred that that's what people think investing in their practice looks like right now. Whereas our members and our attrition rate is so low that once people join, they never leave. I say it's like visiting a puppy. Don't come visit the Confident Clinician unless you're willing to take home the puppy.
Right.
It's a different experience. It's not CE. This is something you can plug into your practice on Monday morning. This is something that up-levels your confidence in 5 minutes after listening to us share. But for people that have been scarred, we offer the taste test, where you can come to the conference and see what it's like. But again, don't visit the puppy unless you're willing to take her home. And for our subscribers, they get access to the majority of our conferences. We do have some advanced training that is an additional investment for people, but we also deliver all of our database content live the first time we do it. So I just finished a module on pancreatitis. I delivered those lectures live, and if clinicians want to come and dialogue and have questions and learn in real time, that's great. But it's also banked for them and searchable. And if it's, if you haven't seen a patient with pancreatitis in the next 6 months, that information will be there for you when you need it. So we want to encourage like those different avenues of learning so that people can connect with the content in the way that like meets their needs.
Right. So you provide both. There's text-based documentation, but also video.
Yep.
Incredible. Cool. This reminds me so much of the first few years of my career. Like, here's how I did it when I came out, because we don't have a residency, right? So you just kind of like use the protocols that you learned in clinic in your 3rd and 4th year. But what I did is I had the textbook of naturopathic medicine on my desk, and I had Gaby's nutritional book on my desk. And all I did was when people came in, I would turn to the chapters for the conditions that they presented with, see what the protocols were, and then I would try and personalize it for them individually. But I didn't have all these extra things. I wasn't able to personalize it in the way that your subscribers are. I didn't have the data for each thing I was recommending and how it might be specific to this individual. I think this is such a cool idea, especially for, I've been in practice for 10 years. I can see the clinical utility for myself, and just having a general practice, of course, where you see like 100 different things every single day. It can become overwhelming a little bit. PubMed is open, but that doesn't mean that it's used effectively all the time. But starting out those first few years, it would have made such a huge difference for me to have all of that information right in front of me every single day. I started working at a clinic where we're attached to a pharmacy. So people who came here had chronic disease. They were referred by the pharmacist. They had chronic disease, and they came in with conditions that I wasn't exposed to in the way that would have brought my confidence to the level that I'm sure your subscribers are experiencing. So I see those first few years as being really important, but this seems relevant to everybody.
Yeah, and it's definitely like thinking about those pain points, right? When you first graduate and we lack mentorship in our industry. People generally in the past have kept their cards pretty close to their chest, right? Yeah. Like, I'm the special person you come and see for diabetes, but I'm never going to tell anybody what I do. And I'm just not okay with that, right? I actually think it elevates all of us if I say, no, this is what I do. Here, have it, right? Like, take it. And so for those newer clinicians, we can really change the tone of how they feel about their career if they can come out and hit the ground running. I don't think they need to spend 10 years slogging it out before they develop confidence. And that's a huge McMaster thing, that students and your age and your level of experience doesn't dictate your potential success. And I think that our newer grads have so much potential, but only if we make them feel that way. Mm-hmm. The way we've taught in the past in our industry is that, the longer you've been in practice, the more revered you are. The longer you have to, when you're in practice for 25 years, maybe one day you'll be half as good as I am. Mm-hmm. That messaging that comes across to our newer grads is not helping any of us. Why don't we make them feel like they can be just as good as we are the day they enter practice? Sure, they don't have the hours under their belt, and there's going to be lots of things they learn in those first 5 years, but we should at least be giving them the tools so that they have the potential to be confident and successful. But then on the flip side of that, we've got our, veteran clinicians who are super busy, who when that pancreatitis person walks through the door, they're like, oh my God, I haven't looked at this up in ages. Mm-hmm. But yet we have this deep desire of being the best at what we do. And so why wouldn't we just give it to you, right? Your time is so valuable as a veteran clinician. You don't have the time to stay up to date in all those areas. And yet you desire that. And so this resource just gives it to you. Mm-hmm.
Mm-hmm. Oh my gosh. So cool. I wonder about what pain points you see the most. Why do people sign up? Like, first of all, when did you launch? When did the Confident Clinician launch?
Yeah, we just had our third birthday. Prior to that, there was a little beta group. We call them the OGs. There was 58 OGs in a little beta group I had before.
That's a lot of OGs.
There's a lot of OGs. Yeah, they're still all there, actually. Were part of a little beta group when we were trying on, some mentorship, some online lectures. This is pre-COVID, right? So this is like before online lectures were a thing. We were hanging out on Zoom. And then we launched in 2021. So we just had our third birthday in January. Nice. We're just short of 700 members. So we've grown really fast over the last 3 years. We have 700 full-time members. And then we interact with another sort of 300 or 400 clinicians with some of our paid per use courses. So over 1,000 clinicians touch our content in a year. And we have 200 clinicians log in every single day. So when we talk about their pain points, whatever their pain is, we seem to be solving it every day they're in clinic, which is really, really amazing. But I would say, and they joke about this on LinkedIn, I'm solving the unpaid labor crisis in integrative medicine. Yeah. Because so many clinicians, they meet with their patient, they go, okay, great, we'll get you your protocol, later this afternoon. Mm-hmm. And then they spend an additional 45 minutes to an hour typing out a treatment plan for their patient when, in theory, as an entire collective, we know what they should do. What's special about the clinician is the way you present it, the order you present it, the context, the education you give your patient. That's what's special. That's what's individualized. The dose of zinc is the same.
Right.
So why don't I just tell you the dose of the zinc, and then you can be special in all the other ways that we deliver healthcare. But it's not fair that you're expected to be, special on the personality side and the delivery side and the behavior change side, but then also go look up the dose of zinc. That's just not fair. Mm-hmm. So that's probably our biggest pain point that we save people is all the time.
The unpaid labor crisis, yeah.
It's all the unpaid labor crisis.
You need to do about 50 different Mediterranean meal plans for me at every single calorie level so I'm not up all night every single night like I have been.
I feel like this needs to be a t-shirt, the solving the unpaid labor crisis in naturopathic medicine. Completely. It can be incredibly stressful, right? Because you want to do such a great job. You want to do the best job that anyone has ever experienced in their healthcare lives, in their experience with healthcare team members. You want to be known for doing really good work. And it's difficult to do really good work when you're really busy. We do a lot of short visits here. So short visits makes this whole thing even worse, right? Because I'm seeing 15, 20 people every day and still trying to uphold the same level of care. And it's literally becomes impossible. And then you make a mistake and somebody leaves a bad comment and that can hurt you for the next little while. You want to prevent those. And so it sounds like with this type of login rate that the pain points are being solved in a very meaningful way. And everyone is kind of sticking around, which was the other thing I was curious about. Is it something you get and then don't need to access anymore? But it sounds like there's a constant sort of iteration, reviews. What's that process like for you? Yeah, that's such a great question, right? Because that's often the work that is it's just not that sexy, the revisiting things and the updating things. It's interesting, we shared this with our members. We have a bit of a value that our content is updated really consistently. And even some of our courses that we've delivered as a paid offering in the past, when it hits its second birthday, we drop it into our general membership and say, look, this was news 2 years ago, but now this should just be common knowledge. So here you go. And we give it to them. But we shared this with our members in the fall where we'd actually looked to update our cervical dysplasia content 3 times before we had enough data to actually warrant revisiting it.
Right.
And so our process behind the scenes doesn't always get demonstrated on the outside. So as we move through our content and our particular reviews, there'd be maybe one study published or a review article published on studies we'd already discussed. There was nothing really to say. And it was only when, and BC was one of the first provinces to make the move around HPV testing, instead of PAP, that we finally had enough content to deliver an update. So our promise is that we're continuously evaluating what we're doing so that clinicians can get the best and the most recent, the most relevant content. But we also are always building. And so it's called a leading edge membership, meaning that when you access the content, you get everything that we have ever done in the past, which is our database has more than 6,000 entries. So you get all of that.
Yeah.
But we also are delivering content live as we go. So this month is premature ovarian syndrome. Next month is Graves' disease. The month after is fibromyalgia. And we're continuously evolving that discussion so that clinicians are adding to their learning month over month. Mm-hmm. The other things that our members start to realize is that they don't have to hold all of these things in their head. And one of the things about being a great learner is knowing what your resources are and where to look. So none of my clinicians are going, oh, great, okay, I've got what she said there about acne and I'm never going to log in again. They don't bother committing it to memory because they know it's there and they know we're updating it. So the next time they need to get that information, they're just logging in and grabbing it. I think we have that like recovering student syndrome where we think that we need to be the master of all information at all times, when really you just need to know where to find it. And so we want to train clinicians to look things up periodically, grab new information periodically from the database. So they do need to stick around, and they do stick around in order to have that experience.
Definitely. You've proven that. What's it like for a new sign-up? What are the first few weeks like? What happens? What can they expect in the first few weeks? Not asking for myself, by the way. No, I am. I am asking for myself, but also everyone watching.
Yeah, it's like very much that first feeling is like that drinking from a water hose feeling, right? That's how it feels. And we do our best. We're like, it's okay. You're about to be totally overwhelmed. And part of the reason for that is because we are so evidence-based that sometimes when you get there, you realize that something that you've been doing in practice is a little out of date, and that's a little uncomfortable. We are definitely of the culture of changing our minds at the Confident Clinician. That's something we celebrate. It's something we embrace, is being updated and changing our minds. Our industry doesn't have a strong history of changing our minds. And so when you come in for that first time and you realize that something you've been prescribing doesn't have any evidence, or the evidence maybe is a bit outdated, that definitely feels uncomfortable. And we help support and coach our clinicians as they come in. We even have an email that's titled, in your first month with us, hey, have we disagreed yet? Because we are acknowledging that probably has happened, and we're going to have some dialogue around where the evidence sits and maybe what we end up doing in practice. Medicine's hard, right? Like there's not a clear answer for lots of things. Lots of things are a big it depends. But it can feel like when you get connected to new information and there's lots of new ways of thinking of things, that can feel a bit triggering, right? So there's definitely that drinking from a water hose experience where you log in and you suddenly have access to so much information. And also it's a neat sort of check around where you are in practice and where you want to be in practice. But overwhelmingly the evidence, or overwhelmingly the feedback, which I guess I'll call our evidence, by the end of that first month, our clinicians are like, I don't know how I practice without this actually now.
Yeah. How was I doing it before?
Well, that's it. And we actually insist that people commit to, we don't actually have, I keep referencing a month. We don't have a monthly option.
Yeah, you do a yearly program, right?
It's year, yeah, which is a big investment. But part of it's because you have to change, right? You've never had this. You've never had someone sitting beside you saying, hey, I know the answer to this. And so for clinicians, especially ones who've been practicing for a long time, they're like, oh, I don't even know how to use this in a patient visit because I've had to rely on myself for the last 10 years, knowing everything off the top of my head. We need you to practice, right? We need you to change. You can't just try it for 1 minute and then go, ooh, this didn't work for me, right? It's kind of like our patients, funnily, when we're working with practitioners on personal development, we kind of do all the same things that our patients do when we're asking them to change their behavior or their health. We're like, you need to invest. And they're like, no, you need to change. This is hard. Clinicians are the same. And so that's why we have that year commitment, because we know you need to try again. You need to log in again. in order to actually evolve as a clinician.
Vitamin Lab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and Vitamin Lab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
I see it so much as being this sort of a type of mentorship, right? Because you have group activities as well, and people gather and talk about how things are going. And I'm wondering how is the art of naturopathic medicine integrated into your program, if it is at all? And if you could speak a bit to your experience as a clinician, maybe for the use of modalities or things that don't have a ton of excellent human trials to support them. What does it look like in your portal for people who are thinking about using or practicing sort of the art of integrative medicine?
Yeah, it's a really good question. I mean, there's obviously limitations to research, and we talk about that all the time, right? There's populations who are just frankly missed. There are standard of care guidelines that there needs to be a read between the lines to say this doesn't actually apply if someone has this circumstance. And so there's lots of times in the evidence where we're either needing to borrow literature from adjacent populations and say, well, this chronic pain looks a lot like this chronic pain, so maybe we can use this intervention. What we want to train our clinicians to do, though, is that we need to be sure when we're making those kinds of decisions that there isn't an option that is really evidence-based. And sometimes we'll come up against that, right? Where it's like, okay, wait, so we don't have any research for curcumin, but we have a lot for Advil. Are we okay with borrowing literature from another population, or should the patient just take the Advil? Like, that's a really important discussion. That's actually a value-based discussion for the patient and a big consent discussion for the naturopath, right? That if we have evidence for a different intervention right here, how come we're choosing a natural intervention? And sometimes that's the right thing to do for that patient, and sometimes it's not. And we want to have those conversations with our clinicians so that they feel really great about what they're doing. They have really great consent conversations with their patients, and that we promote harm reduction, right? Because that's a huge part of what we do is talk about harm reduction with our clinicians. So I think that's really important, right? That it's like, if we have a list of 10 things that have really great evidence, sometimes in our industry, we pick this one over here. We got to ask ourselves why, right? Like, and if we can come up with a really compelling reason, maybe the patient owns a curcumin farm, I don't know. If we can come up with a really compelling reason why we would still pick this other option, that's fine. But quite often we can't do that, right? And if we want to be part of integrative medicine, right, where that means we're working collaboratively with a patient's medical doctor, I better have a pretty darn good reason why I made the decisions I made, right? Because my treatment plan is landing in their specialist's office. But there's lots of areas of medicine where the research is poor or it's observational, and we'd love to try and look at it from an interventional perspective, right? We watch lots of people do great things with the med diet. We don't always have interventional data. We want to talk about that so that we can talk to our patients about it in a language that's clear and helps with informed consent. There's lots of modalities that don't end up on our platform at all, right? Because they just don't meet that level of evidence that we're looking for. Do some clinicians on our platform use those modalities in their own practices? Probably. Yeah. Right? But our promise is that we're presenting the best evidence. And sometimes that's cortisone cream, and sometimes that's colloidal oatmeal. But we're not going to pick sides, right? That's one of the things I really love about, this is a separate point, but we're clinician owned and operated. We have zero industry funding. We've never accepted a dime of sponsorship or anything from a supplement company, which means we're pretty agnostic about what you choose, which I think is really important, because when I come to the table and say, sometimes it's cortisone and sometimes it's oatmeal, I don't have an interest in either of them. I just want to show you the data. And I think that's part of what makes us so special, is that we're not reverse engineering that conversation to say, well, such and such sponsored this lecture and they have an awesome calcium. We're just presenting the literature.
Yeah. What a great approach. That's a really, really, really excellent answer to that question, by the way. For everyone listening, she wasn't prepared for that. That's just a really good answer. I appreciate that.
And in my practice, which I've retired from seeing patients, which I haven't said yet, but I would never use any interventions that I didn't have evidence for.
Yeah.
Because I would feel like it was outside my scope to be stepping into that sphere when I had no evidence to support, when often there's some other thing. And I admit that I didn't do a lot of deep chronic disease work. I never worked with Lyme patients, right? And I can see how sometimes when we work with some of those unique populations that have no support, that we start to get awfully creative with what we do with them. I worked in menopause care. I worked in cholesterol care. We have very, very solid evidence for what to do with those patients. And if there was ever a moment where I wasn't the best answer, I was very confident referring someone to someone else or to suggest that we advocate for a treatment that was different than what I could provide.
Definitely. And there's a ton of skill involved in learning energy-based modalities or modalities that aren't being studied at major universities. There's a ton of skill and ability to communicate the modality in a way that is really difficult for me. And so I haven't been able to take on some of the things that my mentors did. I have mentors who practice evidence-based medicine, but then also have this other side that they truly believe in and have done seemingly really great work with, from patient testimonials and my time spent in their clinics. But I just haven't had the capacity to take on those approaches. And so, I know a lot of the newer grads feel sort of the same way, right? I need something that's going to help me be a very good generalist right away. And it sounds like your platform would be very supportive of that. I've got a super personal question for you that I think is really relevant because I've taught at this nutrition school for a very long time. And a lot of our listeners are teachers and professors. And I've done 14 conferences in the last 4 years, I think. I need to know from you, because you're the expert in this realm, what are people looking for when you're preparing a presentation, for example, that is for people who are seeing patients primarily? That's all they do. What do you need to do to make a really good presentation? What would that look like at a conference, say for me, as a person who has a few coming up, or for those people who are speaking to young grads right now at CCNM or other naturopathic colleges? What should those presentations really look like?
That's a really good question. I mean, I can speak to my strategy and my personal style. And if anyone's ever listened to any of my lectures, hopefully this rings true. But to me, what I think clinicians need is for someone at the front of the room to have really I always use the term got inside the topic, right? That deeply understands the it depends part of all of it, right? That deeply understands who's not being served by our current standards, or who's getting left out, or what's that magic piece where we can, dramatically change someone's outcome with one or two, very particular pieces of knowledge around the topic. And I'm presenting on iron deficiency in men, or iron in men, in the spring. And for me, I'm in the muck right now trying to figure out what that specialness actually is, right? And it's somewhere around what's an optimal level? Where's the arguments and the standards of care? Why does the WHO use that cutoff, but the US Preventative Task Force uses this cutoff? Why aren't athletes being screened as often as they should? Why are athletes losing all of their red blood cells? Is it really from their foot striking, or is it because of, microscopic blood loss? I'm in the muck, and I actually don't know what the answer is quite yet, but I'm close, right? I can see it, that it's wait, if they exercise 3 times per week and they don't eat meat on Mondays and they this and they that, this is how we help. And I think that's what clinicians are looking for, because when they can follow that train of thought and they can see that you have sat with it so long, you've walked your dogs enough, looking out at the horizon going, what on earth am I going to share about this topic? The slides, they're important, but they can look at those later. The way they want to feel when they leave that lecture is that they had an experience where you were guys, look at what we could do here. All we have to do is screen our athletes 4 times a year. That's what this guideline says. like that's what they're looking for, actually.
Yeah.
They can go look up the dose of iron later.
Right.
They're not going to remember it anyways, right? Whether I say it or not. And quite often my slide decks are way too long, and I would never get through them if I actually went through all of the resources, but I just give them away because I'm like, whatever, go, you need to read this later. I want you to feel how this feels to like deeply understand what our role is here. I want you to really understand whose needs are not being met by the current standard of care guidelines and how you squeeze yourself in here, because I actually don't think we need to do anything magical to have amazing businesses and to have amazing patient care. We need to do what the standards are better than what they're currently being done. And we actually have a huge opportunity for that because we can talk to our patients long enough to realize they're a runner, right? Whereas in the walk-in clinic, they're not going to get that level of care. So that's how I prepare, right? But I really like get like almost obsessive on the topic so that I can see it from the inside out to be like, no, here's what's important. That's how I want them to feel when they leave a lecture, is that they're like, I'm never going to forget what Jordan said. If that person's iron deficient, when this happens, then this happens. Because then I know that I've changed the trajectory of their practice and they could plug that in on Monday morning.
Right. Something that's going to change their practice tomorrow. But also that journey, the journey of investigating what you're going to be doing. That's a really smart strategy for presenting. I'm going to steal it. Thank you very much. But I love it because storytelling can be so powerful, right? Like if you're leaving a lecture and it's just someone reading the slide for like all the slides and all the information is there, but it's not settling in. But if it's being told in the way that it's like, here's the story of how I found this and came across this, and here's where I think it's going to be helpful to you. That could be really helpful, really powerful for a clinician watching. Yeah, really, really smart. Tell me a little bit about your career as a naturopath, seeing patients. You already said a little bit about the conditions that you sort of saw mostly. But what type of clinics did you work in? What kind of experiences did you have?
Yeah, I had a lot of failed associateships before I opened my practice. Actually, my husband is a retired dentist and I am a retired naturopath. So we're two clinicians that did not belong in one-on-one care. We innovated and we both do very, very, very different things now than one-on-one care. But the two of us had 9 associateships over the course of about a year and a half. And it was everything from and his were much worse than mine, to be honest. But, unsupportive, not great environments, blah, blah, blah. Anyways, I opened my own practice in 2011, which in lectures that we do on business, my husband and I tag team lots of conversations on business. He's a healthcare business evaluator now. Okay. And so his knowledge of business was amazing. But I opened my practice literally at the worst time in our lives because we had just bought his dental practice. We had 2 kids. It was like just a disaster. But I was a really successful clinician, actually. Nice. And when I left practice, which was just under a year ago, actually, I did work right up until the summer of 2023. I had a very full practice. I would see somewhere in the 35 to 45 patients a week over 3 days while I was teaching at the university. I own the clinic, and so I have associates. I have 7 associates now, but at the time I would have 1 or 2 associates when I was seeing patients. And I saw a diverse group, right? In the end, I only took patients for menopause care, but I've written a book on miscarriage. I worked with a lot of patients in fertility care for a long time. I'm the off-site ND for the endometriosis clinic at McMaster Hospital. So I have great relationship with them and worked with a lot of their chronic pelvic pain and their patients with endo. I did a lot of PMS, PMDD just because it's a special interest of mine of how hormones impact mood. And then I became a NAMS certified menopause practitioner a couple of years ago. And then that was all I did at the end, was work in menopause care, which I loved because it combined things like chronic disease and diabetes risk and cardiovascular risk and bone health and sarcopenia. I love menopause just because it touches so many areas of the body. Mm-hmm. But I had a very, very busy clinical practice. I would do 250 new patients a year every year for 10 years. It was a very, very busy clinic, which I loved. But I just ended up, in the end, I had a million full-time jobs and I needed to make a decision that was going to have greater impact, which is why I left practice.
Yeah, definitely. But it sounds like a really, really great career. It brings to mind a question that we get all the time and that we have tried to discuss on the show a little bit. For those new grads out there, people just kind of entering into this industry, do you think that we should be niching or being generalist? Where do you think that we should stand as naturopathic physicians?
I don't know. It's funny when people are like, what would you do if you had to start your clinic over? I'm like, I don't know if I could do it if I had to do it over, actually.
The answer is no. What would you do?
The answer is, I don't know. Yeah. The answer is, next question.
Yeah.
There's pros and cons, right? I think for everything. And truthfully, I think when people niche, they still need to know a lot. So even when I was super niched, right? Minus the last 2 years where I didn't take on any new patients that weren't in my niche. I had that luxury at that time, right? I had high rates and I only took patients I wanted. And that's a very different piece than my first 10 years of slogging it out where I saw everyone. And I decided I was just going to be as good as I could be at everything. But even your menopause patient has eczema, right? Yeah. That's the thing. It's no matter how niched you get, we still end up having this really deep connection with our patients that usually means you have to be that jack of all trades, or at the very least know where to go and find that information. So even when I was niched, quote unquote, 60% of my patients were still general patients. I just geared my marketing towards the other 40%, right? I talked about the 40%. I did podcasts on the 40%, but I still treated people's husbands. I still there was a lot of general care that I did, and I actually enjoyed the variety of it. I think if I had niched really early, I would have tapped out earlier, because when I graduated, and everyone always finds this so funny, is I did the peds rotation when I was at school, right? When I tell people that, they're like, you did? Because I did not treat a kid for the last 12 years of my career because I hated it.
Yeah.
So I didn't know when I was 28, when I graduated, what I wanted to do. And then I started to do some cancer care. And then I really didn't enjoy that either. And then, so I tried a lot of things on before I realized I wanted to do menopause care. And I think if I had niched when I was right out of school, I might have picked the wrong thing.
Yeah, definitely. That's a really good approach, really. You generalize until you find what you really like what gets you to work in the morning. And you really did that. The other thing that people go through sort of when they're just starting is this risk of debt, this risk of not being successful quick enough to be able to make it financially, to make this into a real career. And it can be super scary for people. We're working with a few associates now who are just starting their careers. What would you tell yourself who just came out of naturopathic college about what to do, how to make a career of this, how to make a life of this? What advice would you give yourself?
I think there are some really key investments that you can make in yourself as a clinician when you graduate from school. The problem is that there's a little bit of trauma when you come out of school with debt, and then you're staring down some other investment that you need to make. But there's a difference between your schooling and your business, right? Those are actually two different conversations, where the investment that it was required for you to gain the knowledge, skill, judgment, license, all the things you needed to open your business, you almost have to think about it a little separately than what it takes to run your business, right? Because it would almost be like if someone, I don't know, I can't even think of a great example. I might butcher this analogy here, but someone studied literature forever, right? And they're like, you know what, I'm going to open a bookstore. And then they decided they were going to open a bookstore, and they're like, I can't afford to buy any books to sell yet, but one day I will have enough to buy some inventory. We would see immediately that that's a failed business model, right? Where you can't sell anything, you don't have anything. And yet we often will approach our careers the same way. Well, I got all the way here and I got all my training and I've got all this debt. I'm not going to invest a dime in my business until I make some money.
Yeah.
But it's almost like inventory, right? If you have nothing to sell, you can't make any money. And there's some really key investments that you could make early in your career, like the Confident Clinician, like business mentorship, like being an associate, right? Where you're not giving away a percentage of your revenue, you're investing in a career that you get to have someone help you, right? That's that mindset shift that you can't spend another dollar because you spent all that money on school, I think probably prevents people from having the career they desire. I don't have a lot of fear around investment in myself. I think I'm the safest bet there is. I'd rather bet on me than bet on anything else, the housing market, anything. I'd rather bet on myself. And I think if we have that kind of mindset, then we can grow our own personal inventory and have something that's really desirable for people to buy.
Yeah, definitely.
I didn't butcher the analogy. It actually came out perfectly.
I loved it. I actually loved it so much. No, I was totally into it. I was along for the ride. This is the value of storytelling for those of you who aren't teaching, who maybe want to be. I loved it. No, the analogy was really great. And it's an inspiring answer too, by the way, because for me, I believe in everything that you just said. I'm all in on self-investment. I'm all about the tech, right? So I buy a bunch of devices and things that support my patient care and help me. We build for them as consults because we just use them during the visits, basically. But they bring some joy and some excitement to my life, and they provide a ton of value to the people sitting across from me. So I'm all about the tech investments. That's kind of my thing. But yeah, that's a really smart answer, and I fully agree with all that. The educational piece, for sure. Confident Clinician makes sense. I wish you were around when I graduated. So that's unfortunate. Inside the platform, are we also getting sort of what's being done conventionally? Are we seeing the pharmaceutical approaches for those people who are in provinces maybe where you can have a very good scope, like in British Columbia here? I have an excellent scope and use a lot of different medications. And also for those who are in provinces where we don't have the same scope, are we getting that exposure to the research as well?
You are. I mean, certainly we don't need to reinvent the wheel where there are wonderful resources to say, use this antibiotic for this UTI, right? Like we're not attempting to replicate other well-established medical resources or databases that are going to give that level of knowledge. Where we like to come in is say, when would you use integrative care? When is there no role for integrative care, right? Where we would say, look, the standard is to do this, and actually faced quite a lot of heat for saying the standard of care for an acute UTI is antibiotics, but story for another day. But where we come in and say, actually, chronic UTIs, like, we actually have the better solution. So our discussion around pharmaceuticals is often like, what's top shelf? Like, what will your patients come to you already on? Because that's incredibly important for us to understand. Where do you come up beside that conventional care to either make the drug work better, reduce the risk of side effects, or prevent the comorbidities that come along with that disease and that drug doesn't touch? Mm-hmm. That's the conversation that we're having about medication. And then sometimes we are just flat out talking about it where the prescribing standards are not being met, right? Where we have so many medications where compliance is the biggest issue. And so we want our clinicians to deeply understand prescriptions, because even if they practice in Nova Scotia, if their patient comes in and they're not taking their medication regularly, they can actually be part of an advocacy for that patient to have better medication compliance. And that's incredibly important. Mm-hmm. And so we're trying not to, again, we don't need to reinvent the wheel. There's some amazing resources on which drugs to prescribe, but it's how does that integrate in our decision-making process as a naturopathic doctor?
Mm-hmm. Wow, excellent. I love that. That's really, really, really great and very cool and so appropriate, I think. We ask this question every single time. I'm interested to know, just because the show is personalized, what is it about you that most people don't know?
I knew you were going to ask me this question, and I was like dreading having to answer it, because I think like with an online presence, right? Like people do
everyone knows everything.
Kind of know. I'm like, is there anything I haven't talked about at this point? That's how I felt initially. But here's a weird one, and I actually think it makes me quite good at my job, even though it's a weird one. Is that actually I'm not a very empathetic person. I score very low on empathy. Now you're laughing.
No one's ever said that.
No one's ever said that. And no. I think we do, like, as people in healing professions, we generally like identify with empathy. And I have very, very exceptional tactical empathy. And if you've done any work on negotiation or on communication, you know that tactical empathy is really important and is very effective at helping support communication and relationship building. And I've taught relationship building and communication at the university for 10 years. But my own personal natural tendency is to be quite logical and non-emotional. And whenever I do any kind of personality testing or anything, it's like, she has no empathy and she has a really hard time making friends. And so, but however, I actually think it makes me quite good at my job because I'm very agnostic. I don't have an emotional connection to saffron. Like there's nothing about the way that I connect with information that would bias or change the way that I would deliver it to someone to help them in their, decision-making process. But that's always something that's so surprising, right? Because people, are like, but you're such a good clinician, Jordan. I'm like, yeah, but it doesn't mean that it has to come naturally. I'm very good at empathy when I do it, but it's not my natural tendency. My natural tendency is actually just be quite logical about everything. But I think that's what everyone wants. That's why we attract clinicians, because that's what they're looking for, is for someone to have that more unbiased approach to data. And then they get to try on the empathy and have an emotional connection with saffron with their patients.
Definitely. Absolutely. Leave it to them, for sure. I'm totally into that. What a great answer. Well, listen, Jordan, that was such a great show. I really appreciate your time so much. You answered the question so well. Where can people connect with you if they want to learn more about you or your business? Where should we go to learn more?
Yeah, ConfidentClinicianClub.com is a great place to start. It's our main public-facing website, so you can see what our offer is, what our values are, and then connect there with some of our free resources. I do publish a monthly integrative medicine magazine called The Stacks, which with a free reader account, you actually get access to some op-ed type articles. I've always wanted to write opinion-based articles in our profession, and I had nowhere to put them, so I just published my own magazine, and now I get to publish them. But we also, in that magazine, we do release some member-only content in the magazine, so you can see what it looks like to connect with some of our blog-style and podcast-style content. We publish, 2 or so member-only content for non-members every single month. So it's a great resource to grab some new information. We publish an abstracts we love section to help us all stay up to date. But it does give you that bit of a sneak peek on what it's like to be a member, which is kind of cool. And then, of course, on Instagram, I say my personal Instagram is having a bit of an identity crisis because I don't know who I'm talking to anymore, whether it's clinicians or patients. But you can find me at Dr. Jordan ND. And then the Confident Clinician Club has their own Instagram as well. And that's a great spot to learn about save the dates and upcoming events that you may want to engage with.
Oh, thank you so much. Tell me the name of the newsletter again.
It's called The Stacks.
The Stacks. Okay, I'll check it out. Well, thank you so much for your time. I really appreciate it. It's very, very nice to meet you, and I hope you have a really great day. I look forward to this episode launching. I think it's going to do really well. Thank you so much for your time.
Awesome. Thanks, David.
Bye.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Dizer and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.